Drug addiction and drug menace has reached alarming proportions as far as Jammu and Kashmir is concerned. There was a time when people spoke about Udta Punjab, but these days it's more about Udta Jammu and Kashmir, and especially Kashmir. To talk about the mental side of things and why so many people are now becoming drug addicts, and even the parliament report says that there are lakhs who have been addicted, and drug abuse, substance abuse ranging from meth to brown sugar is rampantly happening. I have been joined by Dr. Abdul Majid, who is the HOD of the psychiatry department of the SKIMS here in Srinagar, and has worked extensively as far as drug de-addiction and really on research papers on the subject. Sir, first of all, I'd like to know from you the figures, which are clearly alarming. We did a story, and once we went deep into it and we spoke to drug addicts, we spoke to people who are coming out of it, they spoke about the fact that drugs these days are just on your doorstep. And gone are the days when you used to basically think that drug is a far off thing, and your kids are really susceptible. So what really has brought this to this point? Is it the conflict? Is it the fact that this aspect was missed for a long time, and today you have a situation where lakhs of people, and especially younger age group, have become substance abusers?
Thank you very much. First of all, I would say at the outset that, as you said rightly, that substance abuse or drug addiction, what you call, is something which is really a great concern to all of us as mental health professionals. Not as mental health professional only, I would say as a parent, as a part of this society. My children are in adolescent age group. So as a parent, as a mental health professional, I have a great concern for this. I literally started working on addiction-related issues way back in around 2002-2003, once I took up my thesis on drug addiction only. Over the period of these more than 2 decades that I have observed as part of this profession or part of this society is that there has been definitely an alarming increase in the number of individuals who are resorting to these drugs of addiction. And there are multiple factors which are actually responsible for it. You know that wherever there is conflict, you were talking about Udta Punjab, there was a conflict for decades there. The same is true of Kashmir also. That way, we are literally replicating the Punjab way that we are going right through. Second important thing, as you said, is, again, you answered most of my questions yourself, is the availability of the substances, literally at your doorstep. Third is the peer group pressure. And the conflict, which I will again come to, 3 decades of conflict, which has really, really traumatized people, given them a lot of distress, and this distress obviously results in shortcuts in young population who don't have very good, very mature coping mechanisms. They go towards the shortcuts where they will have relief in this anxious process or the distress, and they go towards these drugs and use them or misuse them. Second important thing is that, as I said, that earlier they would say that it is only flowing from the LOC, from the other side of LOC towards this place. But of late, in last 5 or 6 years, what we have observed that the drugs are flowing from the other states now, like Punjab, like Himachal and Delhi, towards this, and vice versa, and from LOC to Kashmir, Jammu and Kashmir, and to other states, and even rest of the countries which we call Golden Triangle and Golden Crescent. So keeping that thing in mind, the conflict, although fortunately for last few years, I would say things have started stabilizing, but still people are traumatized. They have still wounds which are there, which need to be healed and addressed properly. Before
Dr. Sab, you would have seen so many such cases. You deal with such cases on daily basis. So can you tell us some examples which clearly shocked you as well, because you have seen it all? But some patients, and what about the substance abuse? Because now we are hearing that it has even reached to meth, which was something that was not known, blue meth, which is being now used here, abused here, and brown sugar also. So can you tell us about the substance abuse and how how meth is available here? Because there was something that was not associated with Kashmir or with India.
See, keeping in view that happened around 7-8 years back, there was a lot of trouble around, and the heroin started coming in 2016-17. There was a huge surge of heroin, and the study we did with All India Institute of Medical Sciences, New Delhi, on this national pattern of substance abuse all over India, and that was an alarming point for all of us. That showed that we had a huge number of patients who are actually heroin dependent in Jammu and Kashmir, whole of Jammu and Kashmir, starting from Samba, Kutwa, then Kulgam and southern Kashmir and Srinagar and northern Kashmir as well. But meth as a substance or cocaine as a substance coming into Kashmir is mostly an urban phenomena or a metropolitan phenomena. There are a lot of students, kids or people who are working actually in metropolitans like Bangalore, Mumbai, Kolkata and other places, even Delhi, where meth is something which is available there. And if they don't find heroin, opioids there, they go on to a higher substance. Meth is quite costly substance. They have avenues to get them in metropolitan cities, and once they come back, we see that they are detected as meth positive. I think per se in Kashmir, meth has not been a substance which has been so commonly used, but it's a new phenomena. Cocaine, meth, these are the substances which are being used. But I feel this is more of a metropolitan phenomena being replicated in Jammu and Kashmir as well.
Sir, talking of the people who are suffering because of this, there is a specific age group, teens we've seen, and in fact women, girls also. Ratio is changing. I mean, more and more female folk are now coming into this. So can you tell us, as you speak to these people, what is something that's common as far as these patients are concerned as to why they really fell for this substance abuse? What were the reasons? And especially if you talk about Jammu and Kashmir, what were the reasons that you most commonly found and why they really became the substance abuse?
The most common factor that they attribute it to the use of the substance is a peer group pressure. Just taking it for the sake of pleasure, deriving pleasure out of it. A couple of friends going to the tourist destination just for an outing on a New Year, on Christmas or otherwise also. And one of the friends is unfortunately already addicted to it. He's using it already. The couple of friends are not using it. Just to derive pleasure out of it, just to derive fun and feel high, they start using the substance. So peer group pressure, I would say, is the first reason that these youngsters, and the association with the people who are already using drugs, particularly those who are with tourism, who are with transport, who are with other trades which are high risk trades. So there is a risk that if one of the kids or one of the adolescents is already affected by this thing, he lures other people also, maybe for the purpose of business as well, because the older one becomes more of a drug peddler then. So that is a phenomena that has been observed. And what is really shocking, as you talked about the female folk coming with the heroin addiction particularly, it is about that somebody in the family was using drug. I have a family, an example of a family from South Kashmir. Out of 7 members in the family, only 2 elderly are spared. Rest 5 are using drugs. Among them are the 2 young females who accidentally thought that what our brother is using, we'll just check it out. And they just accidentally checked it out and they got hooked it, because it is said that.
So you're saying it's not like a cigarette that you can not get addicted to. So you can easily, you can take it and then you cannot stop it.
Yeah, it's a very, very highly addictive substance, heroin in particular, because it causes physical dependence. Physical dependence would mean actually there is a change in the brain neurochemistry. And this brain neurochemistry changes quite quickly and you become addicted to this substance. You try to leave it, but you are not able to leave it because of the withdrawal symptoms. Right. There are many people who consent to leave it and fortunately are out of it. There are so many heroes that right now we have in our center also who have been able to quit it, but it takes a lot of efforts from the patient, from the families and from ours also. There are medicines available which can make them get well very soon, but it's only hope for us is that they come forward and get treated.
Lastly, sir, talking of the people who consume it, there are basically the excess, which is, as you said, it's very close than people think. So what really has led to this? Do you think that law enforcers need to do more, society needs to do more? And part two of this is the first responders. Obviously, family has to be the first responder. We've, in fact, many people have spoken about the role of family to identify if their kid can be susceptible to this or he's doing it. So what should the parents do? What kind of watch do you think a parent should really adhere to, and what age group when their kids reach, they should get alerted that they have to take extra care? Can you tell us about this? Because that is very important, because if this happens at a home, this can be stopped.
See, as we said that once we are addressing a certain issue which is really burning and alarming, and we need to know about the causes. Now we know what are the causes, what are the factors, be it availability, be it peer pressure, be it conflict, be it whatever reason. So it needs a multiple stakeholder effort. And as they say that charity has to start from home, I think our parents are in denial that our kid is studying in a big school, a big infrastructure, and he can't get addicted. But that is literally a myth. The reality is that these kids come from the all socio-economic strata of our society, be it very rich or middle class or lower class. So it is a myth that the substance abusers or these addicts would belong to the lower socio-economic class. It is no longer, that thing is not there. So once you talk about this multi-stakeholder effort, we need to get together, starting from the home, as I said. Then you have other departments, like you said, about law enforcement agencies, be it police, be it judiciary, be it education department, who have to make children aware, as you said. I would say even from the grade 6 onwards, from the middle school, high school and higher secondary has to be the target group. This is where the population is vulnerable, and they need to be made aware what is good, what is bad, and when to say no to a friend who offers you a cigarette. Today he may offer you a cigarette, tomorrow he may offer you something different, which you will curse for whole of your life. You will become a liability on the school, you will become a liability on your parents, you will become a liability on the society. So in addition, there are other stakeholders which can come in. See, there is a big role of religious leaders who can discuss about it, talk about it in their. We have weekly Friday congregations happening, and people, they talk about social issues. I think this is the big social issue that is right now creeping up, and that has already reached an alarming level. Our religious leaders, our NGOs, our social welfare department, if you talk about the rehabilitation of these kids or adolescents who are already involved in it, I think social welfare department has to be there, supports, youth service supports has to be there, who can actually rehabilitate these people. And then finally it comes to the health and medical education, which is our domain. Wherever you feel that there are people who are suffering from this addiction, we need to project ourselves in a way that we are accessible to you. You please come. There is a big thing in living a very honorable, very healthy life, rather than a shortcut towards a substance, towards any drug of addiction, which actually may give a simple or a transient sort of, or a very shortcut and a temporary relief for some time, but in the long run it will devastate you, it will devastate your family, it will devastate our society, and at large it will devastate our Jammu and Kashmir and India as a nation.
Thank you so much. So that was Dr. Abdul Majid explaining in detail how this drug menace has spread, and obviously what needs to be done. Obviously it's a multi-pronged strategy, but as they say, charity begins at home, and the first symptoms have to be identified. So in this, the parents have the bigger role, people, elders at home have the bigger role to identify, because the susceptible age group is obviously teens. It is from 6th class, that's around 12, 13, 14 years to right up to 20 years. So these 4, 5, 6 years have to be very carefully basically there has to be a watch as far as elders, parents, guardians are concerned, and they have to identify these symptoms. Overall, multi-pronged strategy, everyone in the society, and more importantly now the religious leaders, because if you talk of Kashmir, you have Friday prayers, there are sermons, and this is the biggest social evil right now. So religious leaders also have a responsibility, NGOs, society overall. But yes, it's a drug menace that is spreading like wildfire, and right now is the time that everyone needs to wake up and fight against it so as we can save our next generation. Campus and Tariq Lone, Meet Farid, Srinagar for India Today.